Hi, my name is Charles Nevin, and today I'll be presenting my capstone research project on the drug Kratom for Psych 265 at Washington State University. The drug Kratom is a drug which is exploding in popularity and is becoming an emerging drug of abuse in the United States. Yet it's still relatively unknown when compared to the other drugs such as heroin, methamphetamine, or cocaine. Therefore, I wanted to highlight this drug in order to show its high abuse potential. So what is kratom? It actually originates from a tree which grows in central and southern Thailand, a tropical evergreen known as Metragnia speciosa, which is related to the coffee plant. The red and white veined leaves contain a number of psychoactive alkaloids, and among them 7-hydroxymetragonine is thought to be the most potent. Research done by Darshan Singh and his fellow researchers found that this alkaloid is about 13 times more potent than morphine. So in terms of traditional use, kratom has long had an association in terms of treating opium withdrawal. And this is according to Dr. Suwan Ler, who did a number of case studies in Thailand in 1975. Likewise, a more recent study in the United States performed by Kirsten Smith and Thomas Lawson found that among 500 participants in a residential drug treatment program, a full 70% of those had used kratom either to reduce or stop their non-prescription opioid or heroin use. So clearly, kratom has been used as an alternative to accepted pharmacotherapy such as methadone or buprenorphine. On the other hand, kratom is also being used recreationally across the United States. And this is likely the reason the DEA feels that kratom is contributing to the opioid epidemic and that it needs to be scheduled. Yet before jumping to the conclusion, that it needs to be placed on the Schedule 1 list, the most prohibitive of the DEA's controlled substances, the FDA needs to continue to perform research in order to determine its medical value. Clearly, this could be an alternative to the other pharmacotherapies out there. In terms of the drug's effects, in lower doses, about 2 to 6 grams of powdered kratom gives the user effects similar to the coca leaf, according to Ian McIntyre and his colleagues. So about after 5 to 10 minutes of ingestion, the user is likely to feel a greater sense of energy, a heightened sense of sexual arousal, and a general sense of euphoria. Kratom has a biphasic effect as well, which means that in higher doses, the user would experience a more opiate-like effect. So they'd feel drowsy and very relaxed, and they would also notice a marked decrease in appetite. And so, as with other opiates, tolerance develops rather rapidly with kratom, so that more of the drug is needed to achieve these same effects. So at some point, chronic signs of abuse will begin to occur. According to Darshan Singh and his co-authors, some of those symptoms would include constipation, weight loss, insomnia, lethargy, darkening of the skin, and a low sex drive. And of course, this is to say nothing of the more potentially lethal consequences which could result from the overconsumption of kratom. There have been a number of kratom-related injuries and fatalities. For instance, an article by Fluyao and Reva Digar presented a clinical risk evaluation of kratom in which they documented a number of cases of neurological, pulmonary, kidney, and thyroid injuries which resulted from the overconsumption of kratom. As well, back in 2014, there was a push from Florida legislature to have the substance placed on the DEA's Schedule 1 list due to a fatality involving a 17-year-old boy who had been over-consuming kratom. And as, of course, the DEA has yet to schedule the substance, I find it interesting that just 3 days after I submitted my research paper, the FDA actually released a public announcement which stated that kratom is associated with deadly risks. And since then, Colorado has banned the use of kratom within its state, and the FDA is also now banning the shipment of kratom into the state limits of New Hampshire. So this tells me that there's likely a research forthcoming, and likewise the DEA is likely to schedule it. So in the meantime, kratom is still available widely in a number of states. And so In closing, I would say that if you or anyone you know is considering the use of kratom, exercise extreme caution because there is a high abuse potential which could result in bodily harm or injury or even a fatality. And so I ask you to just take care there. Thank you for watching.